These days, there are things that we can do to look and feel younger, but we can't yet stop the biological clock. There's no Botox for your eggs. When it comes to fertility, there are things that we need to be aware of. And action. So Raelia, we hear a lot about this age of 35. Why is it of significance?
35 is an age that we've looked at in terms of medicine as a marker of when eggs do become less fertile, but the reality is that process starts a lot earlier in life. We have all the eggs as women that we're going to have for our entire reproductive lifetime when we're born, and over the years the quality does decline, and that starts quite seriously from around the age of 30. So by the time we get to 35, about 1 in 2 eggs that we release has no capability of becoming a baby. And that declines quite quickly until we reach the age of 40, when about 9 out of 10 eggs won't have any potential to be a baby. So it's an age where we think women should really stop and think and make conscious fertility choices.
And in a nutshell, what does the process actually entail?
Egg freezing is actually not such a difficult process at all, but it really entails the first kind of 2/3 of an IVF cycle. What that means for a woman who's contemplating egg freezing is that she will have about 10 days of medications that are aimed to help the ovaries produce multiple eggs in 1 month, followed by an egg collection procedure under general anaesthetic or conscious sedation, where eggs are collected. And from there the cycle's over. So the whole process takes about 2 weeks to complete, and at that point the eggs go to the laboratory where they're frozen in time.
So if we are looking at an age range, what do you think is the ideal for suggesting women to start consider this?
In terms of the ideal age, younger is better, because what goes in is what comes out. And if you do freeze eggs at a younger age, in your 20s and potentially early 30s, then the resource you create for yourself has a much greater potential to help you have a baby.
Well, I froze my eggs at 29 and I still feel like it's one of the best decisions that I made, but I'm also aware that it's not completely a guarantee.
When women freeze their eggs, they create additional opportunities to try and have a baby in the future, and it can be the difference as to whether they'll be able to be a mother with their own egg or not. But it's not a guarantee that they'll definitely be able to conceive, and it's really important to talk to women who are thinking about freezing their eggs about all of their options, including how we can help them have a baby now if that's what they want.
So if you are considering egg freezing, it's really important that you have all the right information at your fingertips. So talk to your GP and also seek the advice of a specialist.